Open enrollment has started for many people across the United States. The exchanges are open and many of the subsidies have been extended. There are subsidies that came out with ACA, and then there are new subsidies that came out later. Many exchanges will allow gig workers and independent contractors to enroll onto the exchange. Open enrollment this year runs from November 1st till January 15th. And open enrollment is the time of year where you can choose to change plans, add or remove dependents without any questions asked. Originally, with the Affordable Care Act of 2010, people making 100% to 400% of the federal poverty level qualified for a subsidy. Now that is capped at 8.5% of your income. That with the American Rescue Plan of 2021, if you enroll through an exchange, you will not pay more than 8.5% of your income for insurance. Now that was set to expire in 2022. And that has been extended with the Inflation Reduction Act. Also, we still have the subsidies available to those at 100% to 400% of the federal poverty level. So many people, once they hear federal poverty level, they assume that they do not qualify for the subsidy. However, that's not the case for many people. So I'm going to pull up a chart and hopefully shine some light and some clarity on what exactly this means. So these are the federal poverty guidelines for 2022. This is in for most of the states. So this is 48 states. There's a special one for Alaska, and there's a special chart for Hawaii. However, most of us are going to fall into this. So the federal poverty level is $13,590 for one person. So you times that by 4. So if you make less than 4 times $13,590, you will qualify for a subsidy if you're in a household of 1. Likewise, for a household of 2, $18,310, times that by 4. If you make less than that, then you could qualify for a subsidy. Also, if you are electing health insurance that costs more than 8.5% of your annual income, you will also qualify for a subsidy. So we have this expanded subsidies that were available from 2021 and extended through 2022, and those have now been extended again through 2025 with the Inflation Reduction Act. No income cap on qualifying for a subsidy, and the amount anyone pays for a premium is limited to 8.5% of their income, which is calculated by the exchange. Here's a nice little chart. It shows the health insurance subsidy chart. There are a lot of these available on the internet. This is just one example. So household of 1, if you make under 138% of the federal poverty level, you're going to be eligible for Medicare, Medicaid, or Medi-Cal, depending on your state. Then anything over 138%, this is the 138% of the federal poverty level, you're definitely going to qualify for a subsidy through your exchange. This is 150% of the federal poverty level, 200%, 250, 300, 400. Used to be if you made over 400% of the federal poverty level, you would not get any subsidy. However, it is now capped at 8.5% of your income with no cap on your income. Also, for those making under 150% of the federal poverty level, there is no open enrollment restrictions, meaning that you can enroll at any time during the year. Now, because of the state of health emergency, many of these exchanges have been loosey-goosey, to say the least. You've been able to enroll, basically fill in your effective date and just get coverage. Okay, there hasn't been a whole lot of checking on the qualifying event, because usually you have to have what's called a qualifying event or loss of coverage in order to enroll in any insurance, including the exchange. However, a lot of those requirements have been lifted through the public health emergency known as COVID and the pandemic. Now, we're expecting the public health emergency to be lifted in 2023, so those loosey-goosey guidelines, not checking paperwork, not checking to see if you've had a qualifying event are going to go away. Okay, so if you want to enroll onto a health insurance plan in 2023, you will likely have to have a qualifying event. Unless you make under this 150% of the federal poverty level, then it's really open season. You can enroll whenever you would like. Now, part of the reason why they're doing this is because once these public health emergency is no longer in effect, they're expecting some people to lose their coverage through Medicare, Medicaid, Medi-Cal, and they want people to be able to have the freedom to enroll onto the exchanges. With that in mind, let's say you're over the 150% and you lose coverage somehow through Medi-Cal, Medicaid, some other source, and you're outside open enrollment. It's still okay to enroll. You can still enroll because you had a qualifying event. If you have lost coverage for any reason, you don't have to wait till open enrollment. You can just enroll because you have a piece of paper every time. So every time you lose coverage, you get a piece of paper, a letter, a HIPAA letter, often called in the insurance industry, that is sent to you, and you use that letter as proof that you lost coverage. It's a letter stating who your insurance company coverage was with and when the loss of coverage occurred. And that is proof that you had a qualifying event. So you can use that to enroll onto the exchange or onto an individual plan or onto an employer group plan, onto your spouse's employer group plan. So those are important letters to keep track of. And that's really the basics of it. So we've got subsidies that are still alive and well for anybody making 100 to 400% of the federal poverty level or less. We also have subsidies for those making over the 400% of the federal poverty level that caps out your expense at 8.5% of your income. The only caveat to that is it has to be for a silver or a bronze plan. They do not apply that subsidy to any gold or platinum premiums. You can still buy a gold or platinum plan, but your subsidy will only apply to the premiums that are. You can still enroll on a gold or a platinum plan, but the way they calculate the subsidy is going to be based off of the premiums of the bronze or silver premiums. So if a silver plan is more than 8.5% of your annual income, you decide to upgrade to a gold, you're only going to get the subsidy for the 8.5% of your income for the silver. They're not going to calculate it off the 8.5% of the gold, but you can still enroll in the gold or the platinum. Hopefully that makes sense. So thanks for hanging out with me today. Thank you for going through this. If you have any questions, please feel free to reach out to me. I have a link down below on how to contact me, and we'll see you next time.